Well, the Arkansas Department of Human Services is the largest agency in state government with 7,500 employees, an annual budget of more than $8 billion. It oversees programs ranging from foster care to nursing homes. In March of this year, Governor Asa Hutchinson appointed Cindy Gillespie as the new director of DHS, and she now joins us. Welcome.
Thank you.
Welcome to Arkansas.
Delighted to be here.
How do we compare to Utah, Massachusetts, and Washington, a few of your previous stomping grounds there?
Friendlier, by far, I have to tell you. Everyone here has been so gracious and so wonderful in the way that they've treated me since I arrived. So that part's been wonderful. I am waiting on the weather. I mean, this last week, as everybody keeps saying, it's just a precursor of what's to come. So
it's going to get sweltering. So we need to introduce you to some good barbecue too before, if you haven't had that yet.
Can't wait. Catfish, barbecue, all of that good stuff.
Tell me what made you decide to take this challenge up. You were probably at a point in your career where you've got a list of accomplishments. What was enticing about the Arkansas job to you?
Several things. One is that I met the governor, and he is clearly an executive that knows how to lead and how to put together a great team. And that makes a big difference. If you don't have the right leadership at the top, you know, you can't accomplish anything. The other thing is I had been, for the last few years, consulting, and quite frankly, I missed making something happen. I've worked in health policy for a number of years, and most health policy solutions around this country are really focused on urban areas. I'm actually a native of Georgia, rural South Georgia.
Okay.
And I do feel like Arkansas is nationally known as a place that is innovative in health policy. And I felt like coming to Arkansas, I could work with the team here to try to see what we could develop in the way of solutions that work in rural communities and not just in urban communities. So it seemed like a perfect place.
I've interviewed a lot of DHS directors over the year. We've been around the system for about 25 years, a little bit longer than that. And one DHS director long ago told me that the position is really a lot about managing money and resource deployment more than what is probably the perception of it's the human services organization, and there's just this critical idea of taking care of people. How do you kind of come at the job philosophically with all of that background?
Philosophically, I think I agree with that, with an exception. You know, you have to manage the money well. You need to put in place the programs and the structures that manage the taxpayer resources and allow them to be used as well as possible. But the other part of that is we are, at the end of the day, we're a department that has two sides. One side is delivering programs to people. We need to make sure we can do that, right? We need to make sure that we make it as easy as possible for people to get the services they're required to get, or they're able to get and eligible for. And we need to make sure that we are protecting those that need protection, such as our children in foster care. There's a lot of real hands-on active work our employees are doing on that side. On the other side of our house, we actually run medical facilities. Most people don't realize and think about that. Half of my employees provide day-to-day direct patient care, whether it's through the state hospital, whether it's through our nursing center, or whether it's through our human development centers. So it is not just money, and it's not just, you know, managing checks going out. There's a lot of active work we do taking care of people and protecting people. You
mentioned the governor and his leadership abilities drew you to the job here. What was his directive to you when you agreed to the position? And I mean, kind of what was his, here's your mission? Here's your mission.
His directive was that he wanted me to make sure that I focused on getting the department organized so it was efficient, so that it best husbanded and used the resources the taxpayers gave us, so that we created sustainable programs for the citizens of Arkansas, not short-term programs that would go broke, but that we designed something sustainable. And he also told me that he wanted us to really focus in on what was going on with foster care, as well as how to better engage the faith-based community and the nonprofits in our state that want to help us to carry out the missions.
All right, you have announced some reorganization goals, and we're going to talk about those after this word from our sponsors. I'm with DHS Director Cindy Gillespie, and we're back after this. And welcome back to Talk Business and Politics. I'm Roby Brock. We're with DHS Director Cindy Gillespie. We were talking a little bit before the break about some of your approach and philosophy and what drew you to the job here in Arkansas. Let's talk about some of the changes you have announced. Sure. You have completed your 60-day review. One of the things is you want to reorganize the agency into 9 divisions from 10 divisions. Walk me through just the 10,000-foot elevation of the changes that you want to implement.
Sure, happy to. The department as it's currently structured has 10 divisions, and those 10 divisions each do their own what I call core business functions, core business services, right? So they each do their own procurements and purchasing. They go out and buy everything separately. They each do their own IT. They not only buy their own technology, they also each run their own technology and try to keep it up. They each manage their own finances. They each also manage their own hiring and their own HR. What all that means is at the end of the day, we have 10 divisions. As you said when you started, we have over $8 billion, but we are managing it in these 10 silos. So I may have 5 divisions that, because of the facilities they run, a simple thing, they may need milk, but they're all 5 buying milk separately, right? If you put together everything we need to buy in a central place, I bet we can go to market and get ourselves a really good deal on it, right?
Efficiencies, economies of scale.
I can have divisions that are paying different amounts for the same thing. I have divisions who are using really old technology systems because they haven't got the money to upgrade that technology system, while another division has the money and they're moving along. Got hundreds of different tech systems. They're not integrated into a single system. You get it. It's split up way too much. So what we're essentially doing is reorganizing to pull out of the divisions all of those core business functions and put them in offices that will provide these as shared services down to the divisions.
You mentioned in your sit down with reporters earlier this week it would result in enormous savings and improved efficiency. Those are vague terms there. Do you have some specific dollar figures in mind as you've crunched the numbers on
We
this?
don't. We have some. We do not have specific long-term, but I can give you some short-term examples. For example, our new Office of Finance, within it will be one unit that focuses on payment integrity. And they've already committed to $25 million this year in savings in terms of the way they will find where we are making things that we can do to tighten the way we make payments and save $25 million. We have you know, it's going to be funny to see how some of this plays out. We identified right at the end of the year a group of contracts that we're just not going to renew for next year. And that's over $170 million next year. So in an organization as large as ours, as we begin to consolidate these functions and use, frankly, our buying power and be more efficient and make sure we are that the right hand knows what the left hand is doing and that we're going to market together, I think you're going to see some pretty large savings out of our budget.
Be careful, the governor may grab that and do some tax cuts or something that he's talked about. Last big kind of topic here for you. You mentioned earlier in the interview, talk about some of the innovation that's gone on in Arkansas. Arkansas Works is a big part of that, the Payment Improvement Initiative, another big part of that. Managed care is looming on the horizon, or some form of managed care, to find some more cost savings in the Medicaid program. Where do you see that kind of formulating at this point in time? How aggressive will you be with that?
Where we're working right now is around laying a lot of the foundation for transformation and improvement in those programs. We are moving to do managed care in the dental area. You may be aware of that. We have an RFP that will be coming out within weeks to actually move managed care, move the dental services of Medicaid in the state into managed care. And we've been trying to run a very strong process on that with a lot of input from both the dental community as well as potential vendors. In other areas, behavioral health, developmental disability, long-term care, in all of those areas, we are starting a process to put in place, again, through a request for procurement, through a procurement process, We are moving to put in place the ability to do independent assessments, to do care management, to promulgate a lot of the rules. So you'll see those pieces moving this year.
Will this will be completed in time for the 2017 session, you think?
Yes, sir.
Okay.
Those will all get lined up by the 2017 session. And our plan is to move through both the rules promulgation as well as to go ahead and select a vendor for our independent assessments. And all of those will put in place some of the initial savings and structures that allow the governor and the legislature to have a good session looking at where we take DHS next in these programs.
I wish you the best. You'll have
Thank
your
you.
work cut out for you.
Thank you so much.
Cindy Gillespie, thank you so much
Thank
for
you,
being with us.
Roby. I appreciate it.
All right.